Awesome. So we're gonna go first over substance abuse, alcohol abuse, and then go move on into crisis intervention. And yeah, maybe look a little bit about human abuse, child abuse, and stuff like that. But I think you guys have the scenario with the guy with alcohol withdrawal by now. Forgot his name. They make you take the SEWA score, or has that not happened yet? Like an iHuman case?
We did that the other day.
Okay, yeah. So yeah, you guys probably did that already. So you guys kind of have an idea of what goes on with the SEWA scale and signs and symptoms of alcohol abuse. Yeah, so here we can start talking about addiction. So addiction is the need for when the need for the substance that's being abused is so strong, it starts to cause physical and physiological distress. So how would you guys define physical dependence or tolerance versus physiological dependence?
Well, tolerance is when they continue to get a tolerance to the drug, and so they continue to need more and more and more to get the desired effect.
Exactly, yeah. So it's kind of like an increased need for the substance.
And
Um,
then physical dependence is, well, basically, that's part of the addiction, right? So they
yeah.
have the desire and need.
So this is like, yeah, like you said, this is like a desire, overwhelming desire to use the substance in order to get that, either to get um, rid of the discomfort that's being caused by those physical symptoms that you will have, or just to that desire to get high, the desire to get intoxicated. Yeah. Um, yeah, and it comes with the physical dependencies. You will have physical symptoms that follow. And when it comes to specifically, what's that? Alcohol, you can go about that one. So here, this is just kind of talking about general withdrawal. So when you have withdrawal, that's kind of having those physical symptoms that your body has because you discontinued it, you're starting to reduce the substance that you're taking, and it's going to be specific to whatever substance you're using. So alcohol, being a depressant, your body gets used to having that alcohol in your system to the point where it kind of compensates for having so much of a depressant that its natural state is kind of an upper. It's naturally high and up. Um, so that when you have the alcohol, you get that normal feeling again. So people with alcohol abuse are going to be kind of in a state where everything's going up. Their heart rate's going up. They're trembling. Their blood pressure's going up. So that's why that happens with some of your alcohol withdrawals. Um, well, let's see here. Be specific with then the alcohol. What about some effects that kind of come with alcohol abuse? There's kind of a good amount of them that effect abusing alcohol leads to. So can you guys think of some? Yeah, you have that cirrhosis can come from alcohol, liver failure as well. Anything else you guys can think about? Yeah, so cardiomyopathy is something else that can come in. So if you guys remember when you guys were doing like a hypertension or atherosclerotic disease.
Also,
Uh,
a deficiency in thiamine.
yeah, so that's that like Ryan and Josh mentioned the vernix encephalopathy that kind of comes from a deficiency of thiamine. But yeah, like I was saying, when you guys have that lecture way back with hypertension, atherosclerosis, there exists a link between use of alcohol and the chronic health of your heart. So yes, this is a lack of thiamine, which is vitamin B1. And Wernicke's encephalopathy kind of also goes with something else called Korsakoff's psychosis. So to in total, you'll probably see it written as Wernicke-Korsakoff syndrome, kind of like we mentioned here, where it's a combination of confusion, so the encephalopathy, acute confusion, and then Korsakoff psychosis, so at least a psychotic episode. And this is all from a lack of vitamin B1. So that's something you might see in patients that have a history of alcohol abuse. They might be getting thiamine supplementation. So can anyone tell me about here? So sometimes symptoms of alcohol withdrawal. So here are just like two of like the major things that can come from it, but what are some other signs and symptoms? Kind of we talked about before.
You're going to have sensitivity to light. You're going to have diaphoresis. You're going to have sweaty palms, possibly. Um, you're going to have
Mhm.
an increased heart rate. You could even have, you'd be anxious, panic attacks, depending on the severity.
Mhm. That increased BP. So increased BP. Anything else you guys can think about? Tactile disturbances. Yeah. Can have some visual hallucinations, auditory hallucinations as well. Yeah, you can have a headache. Did anyone mention any GI issues yet? Yeah, nausea, vomiting. So that's part of your scale as well. So photosensitivity, sweating, tachycardia, anxiety, increased blood pressure, headache, nausea, vomiting. So a lot of this you can kind of think about as things increasing. So um your heart rate's increasing, your blood pressure's increasing, your general mood is becoming more anxious. So things are going up. You're having positive symptoms like the hallucinations, disturbances. Your GI is working to a way where you're now having nausea, you're feeling like you need to vomit. All of this comes from the fact that you took away the depressant that your body was using to kind of even itself out once it got used to it. And what about in severe cases? What else can happen? So what else is something that you guys might think about when the body is not able to inhibit itself? Maybe like the brain's not able to inhibit itself. Yeah, so you run at risk for seizures for sure. And it kind of also makes sense as well. Some of the medication that we do for alcohol withdrawal um, helps with that as well. And although the main reason that you're using it is kind of like a substitution, we'll talk more about that in a little bit. Here I also wrote down delirium tremens. So what do you guys know about that one? How would you describe it?
A state of confusion.
Pretty much, it's like I would say there's like a simplified way to say it, but like compared to the other symptoms, how would you define it? But yeah, there's a lot of the same signs and symptoms as well that you see here, but it's more extreme. So this is kind of like a severe case of alcohol withdrawal
Short-term memory or memory deficit.
for sure. Pretty much everything to the extreme. Pretty much all the previous symptoms, but extreme. So out of those, you can see like profound confusion and disorientation, more hallucinations, more tachycardia, even more blood pressure increase, fever as well. I think fever might actually be really bad tremors. So kind of goes with tremors, kind of similar. You'll have really bad shakes. Um, just here too, but not to the extent you'll see here. Definitely a lot more delusions and stuff, paranoia. going on. We already talked about Korsakoff degree. But yeah, it's kind of associated with that chronic alcohol misuse, deficiency in vitamin B1. So some of the things that Wernicke-Korsakoff and confusion, inertia. And this one actually, the thing that makes it a little bit different is you'll see like compared to some of the things you'll have with the rest of your withdrawal symptoms, it comes with like a low blood pressure, can even be like a coma. I don't think it's as emphasized to know specifically everything that goes on in Wernicke-Korsakoff, but more just that you know it exists. It's related to vitamin B1 deficiency. And that's thiamine. Okay. So here I kind of wrote down you guys what scale you guys use to kind of assess alcohol withdrawal. I'm pretty sure you guys know that one, so I'll just write it down. Use your CEWA scale. And that's your Clinical Institute Withdrawal Assessment of Alcohol. Whatever, it's a little scale you'll print out, and then you'll kind of use it to assess the patient. Um, there's also a CAGE questionnaire, which can be used to determine for secondary alcoholism. And does anyone know the criteria or the questions you were asking for this one?
Yeah, so typically it's abbreviated. So C stands for, I think, cut, and then A is like if they're annoyed by people bugging them about their alcohol. G is guilt regarding that, and then E is like eye-opening. So
Yeah, yeah. E for eye opener, which they use to kind of refer to the question like, have you ever had a drink first thing in the morning to steady your nerves? So it's the thing you do in the morning. It's your eye opener. It goes down, stuff goes here. So for it to be positive, it'd be two or more yeses to these. So you would be asking these questions and kind of marking down every time they answer yes, that's a +1. Okay. There's a lot of patient education that goes along with it, a lot of counseling. There's also some medications that go along with treating withdrawal. Some of them are used to help someone wean off alcohol. Some are used to for someone that is at a risk of developing delirium tremens and things like that. What are some meds that you guys can think about for withdrawal?
you can give a few things like benzodiazepines
Mhm.
to help with managing those symptoms. If you're trying to prevent the person from drinking, you can give antabuse
Yeah. Mhm.
as well.
Sure. So let's talk about benzos. Why are these medications given specifically?
Well, they're going to help with the anxiousness and that the patient could be experiencing from the withdrawal symptoms.
Definitely helps with those, but there's actually like a very specific reason. Yeah, the main reason is because it's a CNS depressant. So basically, it's kind of like they call it like a substitution therapy. So it's a CNS depressant. Um, um, so it's substituting the CNS depressant that would be the alcohol they would be taking. So, like I mentioned, that their withdrawal symptoms come from the lack of alcohol in their system. Their body is used to having a CNS depressant, and now it doesn't have it anymore. It becomes normal for the body to be in that upper like upped increased everything state. But we need a CNS depressant to help substitute what is missing. And the benzos also kind of come with that also protection against seizures and stuff because they're risk for seizures. But it also helps with anxiety, tremors, seizures, and all that other stuff. So good, and just be able to recognize which ones are the benzodiazepines. So usually like Zolam, um, like what are Zolam, Lo- there's Ativan. For some reason, the benzos for me, I know them better with the brand names for some reason. The benzos. Yeah, lambs and Pams, that's what it is. The lambs, the Pams. So just be able to recognize them. There's some that are a bit more commonly used with it, but yeah, like Librarian, yeah. Yeah, there's a few of them because there's different the bentos each have different onsets, different length of use. So some of them might be used more than the other. I don't think it goes to that detail for you guys. It's just kind of understanding which ones are bentos and why we use them. And then so how does the antabuse work?
Basically, it has a chemical component. So the moment that the individual consumes the alcohol, it makes them kind of sick and nauseated to the point where they don't want to drink. But this is mostly for people um, that are like long term, where they're trying to not binge drink and stuff like that.
Yeah, exactly. But it's more of a preventative measure to kind of wean them off. Not so much something we'd be giving to someone with acute alcohol withdrawal because it's not really going to help with the symptoms. And while they're at the hospital, they're not going to get alcohol anyway, so there's really no particular reason. So I'll also write the generic name. Ram. Awesome. Yeah, just keep in mind then that you might have like a question, something like what is antabuse used for? To make sure you understand that this is not a direct treatment of withdrawal and it's not a cure for alcoholism. It's just a deterrent for someone that's trying to wean. Alrighty. So of course we talked about thiamine and more. Yeah. So I was just about to get to that. Thank you, Brian. So yeah. So multivitamins, thiamine, all of that good stuff. Because people with alcohol abuse, it ends up having an effect on the GI tract, stomach. So it's gonna worsen absorption. So they'll be deficient in a lot of vitamin, deficient in nutrition in general. And there's also a lot of patient education that goes along with it. So what can you guys think about what might be good for an alcoholic? Let's say let's say we treated their withdrawal. They're not gonna be on antabuse. What are some things we might want to talk to the patient about after?
We're going to want to look at triggers that cause the patient to go back to drinking, identify those so they can prevent it from happening in the future, and then also any local AA groups and support groups.
Yeah. So A groups are Alcoholic Anonymous. I think by now you guys probably already went to an AA meeting and got to see how that was. Yeah, setting a substitute for drinking is also really good. So kind of goes along with finding what triggers you to do it and then finding things to substitute. I think something maybe Miss Gonzalez might have talked about, or maybe I'm confusing things, but it's kind of like if you feel the urge to do it, kind of start thinking about something else for 15 seconds or find an alternative thing to do for 15 seconds, and then you might kind of get that off your mind and be able to kind of sway away from it. Good nutrition for sure, because again, it's going to impact your vitamin intake, your general nutrition intake. Awesome. There's some other meds that are also mentioned if you want to look at it, but I think antabuse is probably like the main one they go over, but there's a few other ones that can be used to avoid um, alcoholism. Like let's see, naltrexone. Yeah, naltrexone. Probably just mentioned it here. Um, mm, mm, mm. Thinking. Yeah, nalmefene. Nalmefene, okay, Revex. One's Revex, another one's I think. Similar, kind of in a similar kind of concept. Again, just maybe just the names. If you recognize the names, it should probably be good enough. I think the main focus though is on your benzos and your antabuse. see what else. Talk about patient education. Other things that we can do is they actually specifically thinks the substitute kind of work with progressive relaxation, tensing up and relaxing later. Um, that's something that can help people fall asleep as well. It's like a trick. You can't fall asleep, you can make yourself tense up and then slowly relax. Deep breathing, these other things here. The AA groups is also very important, and they can get counseling of various sorts to try to help them out as well. Group therapy kind of goes with the AA group. Yeah, that's pretty much it for alcohol abuse, substance abuse, alcohol abuse. Is there anything you guys want me to go over that I didn't go over? I try to just kind of hit probably like the main points. Think there's I skipped over a lot of the patho when it comes to it. I don't think that's typically the focus for this in terms of that. Um, but maybe I can talk about maybe some risk factors here. That might be kind of cool. So it could be genetic to some degree. So family history has a play. Some people are just prone genetically to be more prone to addiction. So if there's a lot of alcoholism running in your family, there's a chance that it's you have like a genetic, what they call like an addictive personality. So things to think about. So a random statistic I have is like children of alcoholics are 4 times more likely than other children to become alcoholics. And yeah, for sure, definitely socioeconomic, social cultural can have an impact as well. Just in general, like the culture you're around, or some people might cope using alcohol because their economic state isn't great. They're like, okay, I'm gonna go to the bar and drink some, make myself feel better, take the pain away or whatever. Yeah, there's a bunch of other stuff that she included involving like the super ego and stuff, but I don't think that's particularly important. Yeah, cultural, social learning, pretty much everything here. Any questions on anything? Yeah, pretty straightforward. And of course, just recommend finding as many questions as you guys can on Quizlet or whatever. You can try if you guys know what chapter this is, you could try looking in your book and seeing if was it Townsend? If Townsend has any questions inside the book, or Quizlet, Townsend, find the chapter in the book, or just look up alcohol withdrawal. Yeah, great. So you can try looking at questions on Townsend there. That should all help. Mostly just practice questions. I think a lot of the psych is pretty straightforward, and it's mostly about just doing a bunch of questions. All right. What about crisis? Yeah, so we're gonna go over crisis after. I always pretty much have the same recommendation when it comes to everything, honestly. Like when it comes to like exams in nursing school, especially here or at least like specifically here, is that you're gonna have your best mileage coming out of doing questions. So obviously your lecture notes are gonna be important. It's good to know what's going on. It's also really good to look up questions because that's how you get a feel for how questions are being asked. You get a feel for things that you think you knew based on just like active recall that you might not have applied in a specific way that a question asks. So it's always going to be your best mileage, um, the best bang for your buck. So yeah, so now we can move on to then crisis intervention. So crisis intervention or crisis in general, it defined it as an individualized experience. So it's going to be different for everyone, but it's going to, in general, be a sudden event that disturbs your homeostasis, the way um, kind of like you operate, and where your usual coping mechanisms are not able to resolve the problem. And there's a few phases that are attributed to it. I think just knowing the basics of it is more than enough. There's like a few key points. So a lot of this, at least for my class, I think a lot of this was like kind of like look it up on your own. So some of this information you guys might not have just because again, I felt like this was pretty much like look it up on your own for my group. But I have some specific definitions and things that I feel were the emphasis. I don't know if you guys have anything on this or you want me to just talk about it. Okay. Yeah, pretty much. All right, so I'll just yeah, okay. I'll just talk about it then. Um, in that case, so stage one or phase one, I have written down as the individual is exposed to a precipitating stressor. So that I would consider that the main point of the first phase. So this is the exposure to the stressor. You're going to have some anxiety and you're going to be employing your typical coping mechanisms, whatever you used in the past to problem solve. That's the step one. So for some people, they get to this point and they're able to solve it with however their coping mechanisms that work, their support system, they're able to manage it. And then they never get past stage one. But for some people, then they move on to stage two instead. So stage two would be defined by failure of previous coping skills. So you're unable to cope. Your skills, whatever you're using before, isn't helping now to the same level. You have a great discomfort. You have even more anxiety. It's starting to really build up at this point. So further anxiety comes here. So then stage three, I would define it as kind of pulling out all the stops, even things that you might have tried before. You're gonna start trying them now, even things that um, weren't your usual go-to. You'll try to do whatever you can. Try to view problems from different perspectives. Try to overlook certain aspects of it. You might attempt new techniques, new coping mechanisms. But at the end, getting past stage three, that's when all your coping mechanisms fail. And you're about to reach stage four, which is kind of where your crisis begins, or like the peak of your crisis. So for stage four, I have that the resolution does not occur in the previous phases. Overall, your anxiety can reach panic levels. You're pushing past that breaking point. And I have underlined cognitive functions are now disorders. Your emotions are labile. They're all over the place. Your behavior starts to represent that psychotic thinking, increased risk of suicide. So if you remember when you hit that anxiety level, the top peak anxiety level, it was called the panic stage. It might come with some psychosis, so increased risk of suicide, delusions. Okay, is that similar to what you guys have or what you guys looked up? I think this might be straight from the book. All right, perfect. So at least for my class, I have written down straight up from Miss Gonzalez. You need to be able to identify the type of crises. She said straight up, it's on the test. So does she say the same thing for you guys? That's what I have written down on mine. Yeah, okay. So yeah, for sure. We'll definitely go over that. And again, I don't think it's about becoming um like having a PhD on the type of crises. It's just kind of being able to understand um what's like what defines it, what's happening here. So I don't know if you guys wanna yeah, she said highlighted. Okay. Do you guys want to talk about these? Does anyone know like does anyone have like their definition of a dispositional crisis? Sure. Well, we'll talk about it for sure as well. Yeah, so this is the response to an external situation stressor. So I'll kind of copy down what I have here. I'll give you guys some interventions as well that I have written down. Again, I think this is straight from the book. Again, it's just kind of having a basic knowledge of it. Um, you don't have to be able to recite it by heart. It's more like you're able to recognize it based on what's going on in the question, recognize the interventions that make sense. So dispositional and acute response to an external situational stressor, such as an abusive relationship. Some interventions that you can do involve physical care for any wounds, domestic violence, mental health counseling, encouragement, empowerment, refer appropriate referrals to whoever needs it. Okay. There's the anticipated life transition. So this one, how would you guys define it? Here, I've highlighted the parts that I would say define it. So external situation stressor, what about anticipated life transition? Yeah, exactly. So it's kind of like a crisis coming from a normal life transition. Maybe the examples that I had was motherhood, fatherhood, new job. It's something that's a normal life transition, something that people experience, but you feel like you don't have control over something, just like you mentioned. You feel stressed out from the anticipation over what you feel you're not ready for. So some interventions can include like a physical exam, I guess, just to see if there's actually any um, consequences from the anxiety and stuff, physical symptoms from anxiety. Um, Having talks, getting that talking through about how they feel about life change, reassurance, support. Yeah, and then identify. So this is ID, like identify problem solutions the best that you can. And I think I remember seeing a few of these types of questions come up in maybe the Kaplan. Maybe the Kaplan has a few questions on the types of crises. There's traumatic stress, which is pretty self-explanatory on that one. It's stress from something that's traumatic. It's an unexpected external stressor as opposed to, well, this one's like external. The other one's like an unexpected situational as well. Um, Traumatic stress. So, traumatic stress crises is one that's precipitated by an unexpected external stressor over which the individual has little or no control, and as a result can feel emotionally overwhelmed, defeated, such as the mentioned example here. So some interventions here that I've listed down is you should be sensitive to the topic. You got to think that someone who was just the victim of a sexual assault might not be like a woman that just got sexually assaulted. If you're a male nurse or something, it might not be the best idea. You might have to switch off to like a female nurse. They might not be too comfortable around you. They might not want to be touched. So you got to be sensitive to and understand the impact of the trauma that it has on that person. You need to be respectful, of course, promote empowerment for what they do. Um, don't force entirely um, them just to spill everything that happened. Encourage them to be able to talk about it when they're feeling ready, um, to talk about how they feel, what they experienced. There's going to be some, of course, some prioritization when it comes to kind of dealing with the psych versus like when you're dealing with a crime, you're gonna want to prioritize maybe getting like a forensic nurse or something to when you're dealing with a crime, that's your priority. And then the psych kind of comes later. I think there's like a few Kaplan questions that are kind of like that, where it's maybe like a, I think maybe one of the examples in Kaplan was like a child that got physically abused. So your intervention maybe is getting the forensic nurse.
It's not forensic nurse, it's something else.
Oh, it's a different thing. Okay.
Yeah, you're talking about something else. Forensic nurse is for crime, but suspected abuse needs to be reported.
Okay. So yeah, so what Kaylin said, if you could hear, so your priority would be kind of report the crime or report what's going on, as opposed to the psych, even though of course you want to worry about it, just in terms of your priority. Just things to keep in mind. I guess uh, so things like that. There's also a maturation and developmental crises, where the crisis occurs in response to failed attempts to master a developmental task, dealing with like transitions in life. So again, this one is just kind of similar to kind of like the life transitional one. One maybe you can think about like a midlife crisis. But interventions involve anxiety reduction, resources that can help aid and with whatever they fail to accomplish. There's the crises involving psychopathy, psychopathology. So this one is a crisis that is influenced by or triggered by a pre-existing uh, condition. So something like bipolar disorder or borderline personality disorder, anxiety, some sort of personality disorder, schizophrenia, so like a borderline or narcissistic, all of those that might be possible to be danger to others or danger to self. And you are encouraged the patient to verbalize triggers. And like we said, they might have to be hospitalized if they are DTO or DTS. Lastly, there is the psychiatric emergencies. So this is someone whose general functioning has been severely impaired. What? Um, the individual is rendered incompetent, unable to assume responsibility for their behavior. So someone who is very acutely having suicidal ideations, people on drug overdoses, people high on hallucinogens. They're psychotic, uncontrollable alcohol intoxication. The interventions there are to, of course, deal with yeah, something like an overdose potentially. Kind of care for any attempt at suicide, overdose, alcohol poisoning. So some of the things that I think was talked about in like a previous class, maybe your Pete's, will be Pete's, was like about the gastric lavage and activated charcoal for poisoning. Precautions that might be needed, 5150, suicide watch, and encourage the patient to talk about their triggers, how they feel about it. Whenever you're in doubt, kind of becomes like a tell me more kind of thing. And can anyone tell me what you feel is the goal of crisis intervention? A little bit. What is the nurse's goal? Yeah, pretty much. Everything you guys are saying is great. So yeah, it's to bring them back to baseline or a higher level of functioning. You're going to worry about safety, of course. Or function, ideally have higher level of function and self-growth perfect. Awesome. Yeah, so pretty much optimally, we would want them to be even above the level of their pre-crisis state. All right, cool. Here, this is straight from the book. This is kind of like steps in crises intervention, which is quite a lot actually. But again, you don't have to have a PhD on this. It's just kind of having the general idea about it. So just kind of quickly going through it, you're going to be conducting an assessment on their psychosocial, how likely are they, how suicidal are they? Are they likely to be lethal to themselves, for example? You want to establish rapport. So you want to be genuine, have respect, good eye contact, be non-judgmental, maintain a positive attitude, identify some of the major problems with that led to the crises. So try to identify what the precipitating event was. Um, Other things that might lead to that event, prioritize whatever major problems they need to help with now. See if you guys can figure out what the style of coping, what they're doing now to cope, what assistance they need to help resolve the current crises and also prevent future ones. Step 4 would then be dealing with their feelings and emotions, allowing them to vent, therapeutic communication, all that stuff. Uh, and says here, eventually you can, with some caution, begin to challenge their maladaptive beliefs. So things that is beliefs that is kind of causing harm, behaviors that are causing harm, or being unproductive for helping them make good choices. Exploring alternatives, implementing an action plan. And it's here when you implement that action plan where that shift from crises to resolutions, where it's really starting to occur once you are doing actions to kind of directly deal with it, make a concrete plan to deal with it, reach that balance that you want. How could you have prevented the event from happening in the first place for the future? And then lastly, like a follow-up, kind of to see um, how they do later. Any questions on anything so far? We're actually like making pretty good time, honestly. It's pretty straightforward, honest. And at the end of it, I'll also recommend you guys to do a few other things you can to help you guys with the exam. No questions on anything? Right. Here we're gonna talk about then abuse. And main thing, there is some like predispositing factors about it, things involving biochemical hormones. It's not really the main focus here. There's some stuff about the neurophysical things that brain patterns or brain parts of the brain that are affected by or that lead to people that might be abusers and stuff. It's not really the focus for this. It's just kind of like a thing that you can know that genetics, your release of neurotransmitters and stuff have an effect, but it's not like the main focus. Yeah, like your testosterone levels, cortisol levels, all of that, dopamine levels, all of that have an effect, but it's not like the main focus for um really for this. It's kind of a lot about understanding the cycle of battering, um kind of like the culture that kind of goes around with it. Um, yeah, I feel like the biological theories is not like a big focus. So what I will talk about is maybe some of the psychological um, theories involved. So there's like factors that abuse. And some of the ones they talk about is like unmet needs or satisfaction, security. So some people kind of like that bully mindset where, yeah, like that bully mindset, they have low self-esteem, so they bully people to feel better about themselves. They have poor self-image. It helps boost that their self-image. Um, yeah, so it kind of validates them to have power over someone. That's like a common thing that might lead to that. Oh, you can't see my screen? Really?
You're on, what are you on?
Human abuse?
It's you.
Can you guys see it? Can everyone else see it? Mm. Can you see it now, Ryan? Okay, I'll do stop share, reshare. All right, what about now? All right, cool. All right, we're so back. Okay. Some other factors involve kind of like there's like a learning um kind of thing that goes with it. So children can imitate their role models. So it's kind of like violence breeds violence. So it's very common, like that cycle of violence. So if children were abused, they're more like the abusers themselves. There's some psychological factor that deals with it, but again, not the priority for you guys. There's some socio-cultural, so it might be some degree a product. Someone might be like a product of their culture and social structure. Um, there's like family breakdowns, unemployment, poverty. All of these things can have an impact on exposure to violence. All of this stuff has an impact on abuse. Yeah, that's also true. So it's good. The exposure to violence might not even have to necessarily be within their household. It might just be like just like society accepts seeing violence in TV, movies. Yeah, like just stuff like that. Like or just real life, bunch of like wars and other stuff happening. Well, it kind of becomes normalized depending on the person. Combination of factors alongside kind of like that genetic aspect we talked about. I'll put just genetics without really putting into detail on it because like genetics in general, basically a combination of all of these can lead to abuse. But again, not everybody that has all of these same things necessarily becomes an abuser. There are people that can break the cycle, and stuff like that. So again, it's just really dependent on multiple different variables. Alrighty. So here, I think from the book, there's like specific definitions of like victim versus abuser. So the main thing I wanna, I guess, get over here is that, um, for the most part, like the victims in an abuse situation are typically going to be women of all ages, races, religions, cultures, education, socioeconomic groups. And yeah, a lot of common things that include like low self-esteem. Um, they often accept blame for the abuser's actions and stuff. Uh,
Oh, it's dark topic.
It's a dark topic, yeah.
Very dark topic. On a marshmallow?
I'm-
Nice. I like marshmallow.
Right? Typically have a low self-esteem. And often take the blame for their better actions. And yeah, it's pretty sad. It's kind of like the abuser takes advantage of that personality type.
That is these very common things. I mean, but I don't think they say it in the book or anything, but yeah, like I'm sure a lot of you guys know somebody who is in a situation or at one point was in a situation, and a lot of times the abuser tends to pick up somebody who they know that can be manipulated.
Mhm.
So that involves people with low self-esteem, or they don't have a lot of connections. They start to get isolated from their family if they did have connections, isolated from their friends. So then it also kind of feels like they can't get out either. It's
Yeah.
sad.
And then when it comes to abuser, it's gonna be typically men.
You
What?
nothing.
And typically they will also have low self-esteem, and we kind of talked about before that they use abuse as a way to validate themselves, feel better about themselves, feel power over other people. And kind of obsessive, pathologically jealous.
I didn't even think that was a word that was used. Pathologically jealous.
Makes it like emphasize.
Oh gosh. Okay.
Yeah, very possessive. They think that their spouse, or they think that the person they're abusing is their own personal possession. They own them, and they feel like they have the right to do whatever they want because they feel like they own the person. And so there's a cycle of battering, and I think this is like good to go over. And I think you guys might be able to remember like when we talked about like the different types of actually I don't remember what they would call them. It's like the uses, like remember like undoing and what they're called? This
Jeez, give me a second. I actually just created some questions on that, but
like different coping stuff. One of them,
no, like you mean like are you talking like honeymoon phase and all
yeah.
that?
Oh,
Oh, what the heck is that called? Yeah, like there's a tension building
Yeah, exactly.
phase. Oh, what is that called? What is that? Oh, cycle of battering. Oh, you're on cycle of battering.
Yeah.
Sorry.
Yeah, I meant like remember how this one's technically part of this, and we had like the flashcards on the Quizlet.
Girl, no, what?
Oh, you don't remember us giving them the Quizlet with the? I forgot.
I have the memory of a goldfish, so like
Alright, true.
let's take it back.
Yeah, no. So the honeymoon phase is also like if you can relate it to when you guys were doing the whatever it was called. It was the undoing. So it's pretty much a direct example of the of like I don't know if it's a coping, it might be a cope. Yeah, so the tension, but we'll talk about each phase though. So the tension building phase is pretty much the provocation. The person is lashing out. I'll just directly copy paste what we have in the book here. And the name kind of makes sense with it. So the way the book describes it is he becomes angry with little provocation, but after lashing out, he may be quick to apologize. And women may become very nurturing, compliant, anticipating his every win in an effort to prevent his anger from escalating. And she just tries to stay out of his way. So essentially, kind of like someone that because he becomes very angry quickly, and they kind of accommodate them in order to basically avoid de-escalate. Yeah, de-escalating to try to avoid the acute battering phase or the incident. So this is acute battering incident. It's essentially the most violent. It can last us like a long, like 24 hours. And the book describes it as kind of like the batterer, the person attacking, justifying their behavior. And then he kind of just pretends it was never his fault, almost. It was like, oh, you made me do this. And that kind of
Well,
vibe.
if you hadn't have done this, I wouldn't have done this to you.
Yeah,
Mm.
exactly what Kaylin said. So, person will start blaming the victim as if like you're the cause, you're the reason I did that. You're the problem here, not me. You brought me to this level, kind of thing.
If you hadn't have worn that outside, I wouldn't have punched a hole through the wall.
Yeah.
I
And
saw
then
that on an Instagram account recently.
in the honeymoon phase, that's when the batterer, it's like that undoing. They become extremely loving, kind, contrite. They will buy, it's like, oh, I buy them flowers and be like, oh, I will never do it again.
I'll never do it again, baby. It was an accident. I promise. I
Yeah.
love you. Wow, that's a really long definition.
Yeah, it is. So it's kind of I'll highlight some of the most important stuff here. Yeah, all of this pretty much a manipulation task. Based on the feelings of guilt. Um, it's kind of in the name, they're kind of loving, kind. They act like that to be like, oh, I'm sorry, I didn't mean to do that. You made me do that, actually.
Well, it's kind of I don't want to say at that point that they're still like blaming. It's more in the like acute and
Yeah.
tension building. At this point, they're like, "Oh, I'm sorry. Like, I'm gonna give you this. You know, I love you, right? I was just so stressed at work and this, and I never do it again. I love you. You're the only one for me." So on and so forth. So it makes them believe like, oh, maybe this was like a weird like one-off incident. Like maybe like this was just a one-off thing. It kind of like throws whoever the victim is into this cycle of like which one is the real version of this person, and it
Mhm.
gets them very confused.
So
It's gonna start all over
yeah,
again,
that's why it's a cycle. It's a circle.
unfortunately.
So one of the questions that
A big
we
one.
went over in like class, or at least Marsta, is like, why do they stay?
That's what genuinely I yeah.
Mhm.
Financial safety, I feel like are big reasons.
That's true.
Children as well. The one that they specifically say is fear of retaliation.
Yeah.
Losing these are all like genuine reasons though, but the biggest is a fear of retaliation, hopefulness. Aw.
Aw.
Well, that's a positive one in all of the things. Others' opinions, dang. Lack of attention, dang. Oh my
Damn.
god. This is getting deep in here. But in the end of it, it's the fear of retaliation because when they leave, what is the fear of like when they're actually packing up all their stuff and they're out the door? Like, what's at biggest risk right here? I suppose. I think they've said this in lecture, right?
I think so.
I'm sure there's a better way for me to word this, but I can't think of a better way to word it.
Mhm.
Sorry.
Getting hurt again. Yeah.
Getting hurt or
Maybe even dying.
dying. Highest, you have the highest risk of dying at this point when you're trying to leave. Because it's kind of like the ideology of like, well, you know, you can't leave me. So like if you leave, like no one's gonna have you. And
Yeah.
so you're at highest risk of injury, death at this point. 75%. Yeah, it's really sad. That it's abusive relationships are terrifying just because at this point you're playing with your life. Like getting out is never as easy as what you think it might be. It usually you need a lot of help to get out sometimes. But yeah, so your highest risk of death is when you're trying to leave. But yeah, kind of sad. 75%. I can't believe she gave a statistic for that. I don't
Wow.
remember that in class.
That's a lot.
That is an unfortunate number.
That's bad.
She's a big ego.
Big ego.
Big ego.
Yeah. And then lastly, we're going to talk about child abuse. For this one, I think it's being able to kind of, I think there's some Kaplans on this one.
I think
For sure.
balls, to be
Yeah, so it's kind of like they gave a scenario and then it's like, oh, what type of abuse is this? So I actually have a lot of information on this one, but I think again it came a lot of it from the book. But we can go over. How much do you guys know about child abuse? How much do you guys research on your own out of curiosity? Oh yeah, that sounds about right.
Worked in the book?
Like with the book during class. I think we have the PDF.
I don't know. Anyway,
Yeah. And out of curiosity, uh, did you guys already do your psycho farm, or is that next week, or when is that happening? Next week? Okay. Did she tell you how it was gonna go down? Yeah, okay. So that was the same for us.
group effort.
So I think it's your clinical group. You guys will all take the kind of together. And I think you guys can get full points missing up to like 3 or 4 or something like that.
Yeah, I was gonna say.
Oh no, you're right. She does choose the group.
Because I forgot who I got put with.
You're
but
right,
it
you're
was
right,
like-
you're right, you're right. And I think she says it, but oh, she doesn't say it, but like she basically says she'll average it out and do what you will with that information.
Bruh.
She says she averages it out
But yeah,
in terms of the groups.
it's not too bad, but know like your specifics on each. I want those points. I felt that. Know your specifics on like drugs. Like if a certain drug has a black box warning, know the black box warning. If there's a certain lab that you need to know, then know the lab. Know what you need to assess for with the class of drugs, or if a certain drug requires specific interventions or assessments, know those. I feel like there might be a couple random-ish things in there. Like
Yeah,
the
I
one I
remember.
remember, I was like, there was somewhere I was like, oh, I didn't look at that. Oof. ADHD.
I don't remember. There was okay.
There was like one.
Because I think
I got lucky that I knew.
yeah,
it.
she has ADHD, so she, what?
That's illegal, actually.
Oh,
You
is it?
violated HIPAA.
Oh shit. Okay. But yeah, I think in your was it your SLOs or your whatchamacallit? I think I remember like when we were doing it, and I think it like said ADHD drugs in there. I'm like, we didn't go over that at all, or like barely at all, or at all actually.
With it, but I think I looked it up on my own time.
Yeah, but it's in there. It's in there. So just like a
Just look it up.
yeah, just like a quickie on stimulants. What? Yeah, so we can go over child abuse. I think for this, I'll think probably the most important thing here is probably going over the signs. So some signs,
Some signs of physical abuse.
yeah, signs of physical abuse from the victim, from the person, the caregiver, for example,
Quote unquote caregiver.
quote unquote,
Quote
yeah,
unquote.
quote unquote caregiver.
Quote.
So which ones can you guys think about from like some things you might hear from children, from the victim?
The child. Or see. Hear or see, so something.
Yeah,
like my
here,
thing.
see,
Bruising.
for sure.
Where are the bruises gonna be? Pain when sitting. Aw. Avoiding gym, yeah. Where are you gonna see that bruising though? I don't know if they went over it too much, but just something. The back, the arms. It's gonna be in some weird places sometimes
Yeah.
because they don't want it to be discovered. So like the back is a good place because it's
Mhm.
always covered by a shirt. On the bottom, back of the arms if it's covered by a shirt. That it's kind of not as likely that it's gonna be straight on somebody's face.
Yeah.
Oh, the
Culture.
culture. I forgot about that one.
Culture?
There was like a.
Isn't that part of the
I think that was part of another
community?
week.
No?
Was it? Well, there was cultural care in week 6. That was the previous week, but I feel like there was Yeah, I was like,
Oh,
some cultures
coining?
will, yeah, the coining. That's why I was like, I forgot.
Oh
what
yeah,
week
yeah,
that
yeah.
was.
That was during community, so that's like yeah, the coining. The PowerPoint. I think the PowerPoint on this stuff is enough to answer the questions. When it came to the community stuff. Yeah, so you guys mentioned unexplained bruising, hidden areas a lot of the time. Black. I'll just kind of add some black eyes, broken bones, and it's
Dang.
unexplained. All of these are like unexplained burns. What are some other ones you guys might think about? How might they act around certain people?
Aw, sometimes
Uh,
children will point to areas. Prank around adults. Oh, that's so depressing.
yeah,
But yeah, shrinks around adults, which kind of goes with the ideology of seeming frightened
yeah,
around an adult.
and then
Doesn't want to go
yeah,
home.
that's really
So why don't you want to go home, sweetie?
yeah. So, and then another one that's kind of from the list, the book is includes potentially even like abuses animals or pets. So kind of like we talked about,
A cycle of
kind of that cycle of abuse where they're like, oh, I like they take their parents as role models. They see parents as abusing them, and then they start doing the same thing to animals, pets. Yeah, it's really sad.
learning theory.
Yeah, it's relating to the abusing, like the abuse.
Oh, oh, oh,
Mhm.
oh.
And then what about some from the abuser, the caregiver, quote unquote? I think for the most part on your questions this is pretty obvious. Like you
Yeah.
see it.
They bring little Tommy into the ED. He has a bruise on his arm, and you ask him, you the nurse ask them, "Oh, how did Tommy got a bruise on his arm?" "Oh, well, you see, he was sweeping the grass, and just kids, right?"
Yeah.
Unconvincing. Yeah, I was
Yeah.
the sweeping the grass. Uh-huh, you were sweeping the grass. Sure you were.
Kind of things that don't make sense. They don't have an explanation for the injury, things that don't make sense.
Or it's like, oh, they fell on their butt and they have a bruise like on their elbow or their upper back or
Yeah.
something.
Like multiple bruises of different different healing
Stages.
stages. That kind of goes here as well. Want ice cream?
Yeah. Kind of make some of it.
The pretty good one, a pretty common. One that the book describes is like describes the child as able.
My God. It's kind of sad. I've seen videos from like former teachers and stuff, and they say like some parents come in and they're just like, "Oh yeah, like my daughter, watch her because she'll steal stuff from you," or like, "Yeah, my son, yeah, he's a horrible kid." Like they'll literally tell adults this. It's sad. They have a lot of
Yeah,
history of abuse themselves. Cycle of abuse coming back real hard there.
basically the same thing. That cycle of abuse going on.
Wonderful.
And again, when you guys see it as a question, it'll be a little bit kind of obvious. I'm sure you guys
I can
can
stop
figure it
studying.
out.
It's common sense.
Yeah. Stop studying. It's common sense.
Yeah.
But yeah, again, you don't have to like hard memorize everything here. It's just kind of like the general idea. Should be good. Then next up, there's emotional.
Arr.
What are some things that they might do? Yeah, for sure. So extremes in behavior.
What is it? What does that entail exactly?
Yeah, you to be very specific.
By the way, you guys are killing the game here.
Really are. We're getting through this pretty damn quickly.
Demanding behavior. Yes,
Exactly.
they could be demanding. Passive.
Yep.
Extremely
Like
passive.
overly compliant, passive, overly compliant.
Aggressive.
Yep.
Dang. Yeah, pretty much. They're pretty extreme changes all
Yeah.
over the place. Yeah.
Other ones that they might
Aw. I want an A. I would settle for a B. I felt that one on a personal level. That's okay. I think at one point or another in nursing school, it's like, man, whatever I get at this
Yeah.
point, it'll be fine. I'm fine with it. I hit that point at one point. I was like, it's whatever. Yeah. So what are we on, child? Okay.
Yeah.
What else would you see? So we have the extremes in behavior. What else could we see? Depression and anxiety.
Yeah, so for sure. So one of the ones here is like has attempted suicide, so that kind of goes with depression, anxiety. So some other ones that I have here is kind of reports lack of attachment. Yeah,
Unattached to the parent or caregiver.
usually children like well,
Sorry.
usually there's some sort of level of attachment to the parents, but when they're emotionally abusive, like to the point where it's like I don't, I'm not attached to them. I don't really care about them. And then I think another one that is good is they're delayed in development. So like a physical or emotional development. So they might be behind on certain aspects because humans really rely on that social emotional connection to develop as people. So they might be behind on certain things. And then some indications from the abuser. Ones that's kind of obvious is like overtly rejects them, is consistently blaming them. And in general, they're just, yeah, they're belittling them. And I'd say like is unconcerned for them. Again, they don't pay them no mind. It's just like, yeah, you do your own thing. I don't. It's like and there's a lot of uh parallels here or kind of like overlap with the abuse and then the neglect, and emotional neglect. So for this one, I kind of clustered them together, so I'll kind of just talk about it, I think. So neglect from the child is like they might be frequently absent from school. They're neglecting them to the point where they don't even keep track that they're going to school. Yep, exactly. Begs or steals food or money. They're not even providing their children food, not giving them money for lunch. Um, lacked any needed medical or dental care, vaccinations. If the child needs glasses, they don't have them. They're just, yeah, exactly. Dirty clothing, unclean, um, pretty much unclean, body odor, consistently dirty. They might be abusing drugs, alcohol. And an obvious one would be states that there is no one at home to provide care. So some signs and symptoms from the abuser, on the other hand, is that they might be apathetic, meaning they don't really have any emotions one way or the other. Um, they themselves might be abusing alcohol. Yeah, exactly. They're too preoccupied with their drug addiction to care about their child. They're indifferent, apathetic. they're just behaving in a bizarre way. It's kind of like a wow. And then there's also lastly the sexual abuse aspect. So I'll go over that as well. So what are some that you guys can think about? Yeah, difficulty walking and sitting, UTIs. Are,
Nice for days.
yeah, very common.
Becomes pregnant
For sure.
at wedding,
Yeah,
like
the-
a regressive
yeah.
behavior.
Regress, yeah, exactly. Regressive behavior, bedwetting.
Unusual sexual knowledge.
That's a really good one.
Runs away. Yeah.
Yeah.
Oh.
Runs away from home. Something that is mentioned in the book is they have an attachment to strangers or new adults
But
in their environment. Quickly, they become quickly attached. Kind of like almost like a call for help kind of thing.
kind of seems like it.
Mhm.
Child
Yeah.
reports it. Yeah.
Yeah.
I
Oop.
hope they do.
Perfect. So yeah, these are some of the things that you guys
Was gonna say another one that was actually attached to our notes. It was on the same line as pregnancy, but kind of like with UTIs and whatnot, they can have an STI as
okay.
well. So it's like, why does a 7-year-old have chlamydia? No, it's probably concerning. I don't know. Just a thought. So, I mean, it's one of those things where it's like if you see it, you know it. But
Yeah.
I just thought I'd put it up there.
What about from the abuser's end?
Yeah.
Yeah, for sure. So these people become controlling of the child, controlling, protective of the child. Like, yeah, I don't want you. Like they kind of take them away from the rest of the family. Um, if I had to guess, live in contact with other children. If I had to guess, it's probably to try to keep them from saying anything, being like the only person you report to is me. The only person you're spending time with is me. Yeah, yeah. They're secretive, they're isolated. I like that. Favoritism.
Just give it
Gifts.
to the child for no reason. Yeah.
Just strange behavior on that end.
Oh, that's
Yeah.
a big point.
Yeah. And then overall, something that I really want to emphasize is even though you guys are in psych, your focus overall in general when it comes to pretty much everything is that your priority is to meet medical needs, you're meeting safety before the psychosocial aspect of it. So again, if someone comes in for abuse, you're going to help them with whatever medical needs they have. You're going to keep them safe. You're going to report it first before you worry about emotional, even though, of course, we want to be able to do as much as we can.
Can't give emotional support to somebody who's being taken away out of their will. So,
Right.
there's that.
So, let's say I was gonna talk about the highlighted part. I thought that's what you were going for.
Oh yeah, that too.
But yeah, let's say they come in and they have some kind of injury on them. And a lot of times the protocol for hospitals, if somebody has an injury of sorts, you take a picture of it, report it like that, so that it doesn't come back and on the hospital. Like they can't say, oh, well, that bruise wasn't there on admission, so you guys did that. So a lot of times you have to take pictures. But these are children we're talking about. So at the end of the day, it's up to the parent, the adult that's there, to give consent to have the child's photo taken. So sometimes they say no. I mean, it makes sense. Like if somebody is abusing the child, you don't want to get caught.
Mhm.
So they can deny having a picture of the kid taken, and that is unfortunately within their right to do so. But you can do other things to. Are you pasting that?
Oh, oops,
What happened?
accidentally take control.
Oh, bruh. Are you,
Boom.
okay, you looked like you're struggling there. But yeah, so having proper documentation, instead of the pictures, even if you don't have them, reporting objective data about it. The patient had wait, but you can measure it. Yeah, you can measure. Wait, you mean like the injury, right? Sorry. I just realized that comment came in. I don't know what. Okay, cool. Yeah, you can measure it. So like, let's say it's on the upper arm. So, patient has, bruising, ecchymosis, whatever, to left upper arm, measures 2x2. Patient states, in quotes, this is where I got whatever. Guardian states, this is what happened, and put it in quotes. You could say, you can't really say like, it seems like the patient is lying. It seems that the parents are lying. Like you can't say that. You just have to report whatever is objective. And then go and report to, I don't even know who you report to, like unit manager or something.
Probably just go up the chain of command.
Chain of command. So that you get the process started and can document more about it. But yeah, so that's just a thing, because like a picture is kind of like the obvious, like, oh yeah, there's an injury here, but try to be as descriptive as possible if you can't get the picture of the injury, what they said happened to it, what they feel, the pain that's there, whatever. It's your documentation is a really big part of that in court of law. Yay,
Mhm.
court. Okay, sorry.
Yeah,
on.
that was great.
Go on. Go on, chat.
So yeah, that's pretty much
That's it.
it for this week. Oh yeah, one more thing I wanted to talk about is I think in this week you guys had homework to do where like you answered a bunch of questions. Something like that, right?
I don't remember.
Is that
I'm so
accurate?
sorry. The eating. Oh, the case study.
Yeah,
Wait, that was due this week?
No, the other one. There was like another one. Here, I'll see if I can look for it. Yeah, the article questions. Yeah, that one.
What? Oh, yeah, I remember it actually.
Yeah, you should. A birdie said to know those.
I think that's a very important thing to look at. I think that it really reemphasizes a lot of important points. So I think that it's a great resource to go through.
Yeah, go through them again. The questions. Allegedly.
Is this a highlighter moment? Mental knowing the stats. Oh, she told you. Okay, so know the stats from the article.
Yeah, so basically, go through the, before your test, just like take a,
Look through.
yeah, give it a quick look through the questions and the answers.
Wait, when is their next test?
I don't know.
Is your guys' next test the Psycho Farm and the final?
Thursday. Oh yeah, they do them on the same day.
This
Not the
time?
final, sorry. Whatever test they're doing now, they do them the same. They do it, and then they do the psycho farm.
Oh
I think.
geez, wait, so exam, then go across the hall for the quiz. Dang. Exam 3 is Thursday with Psycho Farm. Oh, I did not realize that. Okay, so exam. What is this exam on? The pre-lecture was very time
The
consuming.
eating disorder one, yeah.
Okay, so just plus culture. Oh, yeah, I remember this. What you guys went over in cultural care. Cool. Okay, cool beans. That I can do. 'cause yeah, I'm doing questions tomorrow. I'll try to see what I'll look through cultural care then. I didn't include anything on it because I forgot that that's also part of the test. I keep thinking it was on the previous
I thought it was
one.
in the previous one.
No, it's part of this one because they took it on the same day. So I'll look through cultural care, and if I find, you know, stuff that I can do questions out of,
Yeah.
I'll add them onto the question session tomorrow.
I'm gonna stop recording.